my name is Patricia. I'm a Medicare and health insurance broker. And this video, I am going to talk about Obamacare and early retirement. Obamacare can be the perfect option for someone that is in early retirement, not quite ready for Medicare, but definitely need health insurance coverage. So in this video, I'm going to break down how Obamacare can be the perfect option for you. So definitely keep watching. First, let's talk about what is Obamacare. Obamacare is the Affordable Care Act, also known as the Marketplace Health Insurance. So basically, Obamacare was put in place to help individuals pay for health insurance. There are 10 essential benefits that must be put in place within that insurance plan to be classified as Obamacare. So what are those 10 essential benefits? I wrote them down so that way I do not forget not one benefit. So the first essential healthcare benefits that must be included to be classified as Obamacare is your chronic disease management, preventative care, and wellness services. So your chronic disease management would be like managing your high blood pressure, managing your diabetes. Preventative services would be things like going to get screenings done, mammograms, checking for colon cancer, and things like that. This is one of the things that I would say is the most important benefit of the 10 essential healthcare benefits, okay? Another thing would be outpatient care, such as going to see your doctor or going to get outpatient care at a surgical center. So outpatient care, ER services, so going to the emergency room, hospitalization, so inpatient hospital care, laboratory services, which would be like getting your blood work done, also prescription drugs, so getting your medications, mental health and substance abuse treatment as well. Also rehab services such as physical therapy, speech therapy, occupational therapy. These are some great essential benefits, right? Also pregnancy and newborn care as well. And the last essential benefits will be pediatric services, so services for your children, and for your children that will include dental and vision. So those are the 10 healthcare essential benefits that must be included to be classified as Obamacare. There are two key things that you need to take note when it comes to Obamacare. Number one is that you don't have to answer any healthcare questions. So no questions regarding your health whatsoever. So Obamacare allows pre-existing conditions. So you can have high blood pressure, diabetes, cancer, it does not matter. You would not be denied due to your health, okay? So that's number one, pre-existing conditions are allowed. The second thing that you want to take note when it comes to Obamacare is the low income subsidies. So what does that mean? With Obamacare, it comes with low income subsidies, meaning that the government will help pay for your costs if you qualify for the low income subsidies. So basically what that does, it lowers your out-of-pocket costs, not with just the monthly premium, but it can also help you lower your co-payments, your co-insurance, and your deductibles as well, lowering your overall out-of-pocket costs for your health coverage, and I will show you how that works later on in this video. Now let's talk about open enrollment period. So open enrollment period is when individuals can go ahead and get on the marketplace and apply for their health coverage for the following year. So every year between November 1st to December 15th, you can apply for health insurance, and your health insurance coverage will start January the 1st. Now, if you enroll between December the 16th to January the 15th, then your plan will start February the 1st. Now let's talk about a life-changing event During a life-changing event, you can enroll in a Obamacare plan. You have about 60 days to enroll in the plan, okay? So what are the life-changing events? You have losing health coverage. So say you lost your job, you lost your health insurance, well, you have the opportunity to go ahead and enroll in a Obamacare plan. Also, if you recently got married, you can also enroll in a Obamacare plan as well. If you change your primary place of living, if you were released from detention or jail, you can also enroll in a Obamacare plan as well. You can also enroll in a Obamacare plan if you adopted, was placed on adoption, or placed in foster care. You can enroll in Obamacare. Also, there is a special enrollment period going on right now for low-income individuals all through the year. So if you are a low-income individual, you can also enroll in a Obamacare plan. This is a special reason, and right now it's said to last until 2025. Okay, so those are the special reasons why you can enroll in Obamacare besides open enrollment period. In order to apply for Obamacare, you do have to earn income, okay? Taxable income. And what you want to do, you want to estimate your income for the year you want to have insurance. So if you want to have insurance in 2023, you're going to estimate what is your income in 2023 before taxes, okay? And also please report if your income do change, okay? So say you get a subsidy because you're very low income, and say your income doubles, you definitely want to update your application so that way you don't have to worry about paying that subsidy back, okay? So if your income changes, definitely make the necessary changes to your application, okay? Okay, so now we're going to do a case study for an individual that is 62, that is deciding to retire early, and I'm also going to show you how the subsidy will work for a 62-year-old person that is low income and that is going to retire. Okay guys, so I'm going to show you guys really quickly how to choose a plan that will save you hundreds and hundreds of dollars if you do qualify for the low income subsidy. And we're going to do a quote on a 62-year-old male that is retired, okay? All right, so let's get into it. All right, so let me go ahead and share my screen. I'm going to show you guys my quoting tool, and also I'm going to leave the link to my quoting tool if you want to enroll yourself. But I do recommend that if you are a little confused, maybe have some questions, to go ahead and call me and I will do the enrollment for you, okay? And my services are 100% free. All right, so let's get to this quoting tool, okay? Let me share my screen here. Okay. Alrighty, so like we said, we're going to go ahead and put in our zip code here. And we have a young gentleman. He's 62 years old and he is retired. We're going to say he's single and his income is about $14,000 per year. So as you can see here, he has a savings of $1,101 per month. As you guys can see, he has two different types of savings. So the first savings is for the monthly premium, okay? So his savings is going to be $1,101 per month. And he also get another type of saving called a cost sharing reduction, okay? This discount lowers the out-of-pocket expense for deductibles, co-payments, and co-insurance for the silver plans only. It's very important to take note that this extra savings is only going to count for the silver plans only, okay? So let's look at the different type of plans. So here we have Oscar, and this is an expanded bronze, okay? here are the different types of plans. So we have bronze, expanded bronze, silver, gold, and platinum. And like we know, if we choose the silver plan, we're going to get more savings. But first, let's look at this expanded bronze, okay? So this is an Oscar plan, $0 a month, zero deductible, not bad until you get to the out-of-pocket max of $9,100, $50 for the doctor visits, $125 to see the specialist, and $3 for generic drugs. And we want our savings to be just a little bit better than that, okay? So what we're going to do, we're going to go ahead and click on the silver plan. Okay, so there's two type of networks here. We have an EPO and a HMO. So with the EPO is a managed care plan where services are covered only if you go to doctors, specialists, or hospitals in the plan network, okay, except in an emergency situation. Your HMO is limited coverage to providers who are within the plan's network and require a doctor's referral to see a specialist. Please review the plan's summary of benefits of coverage document to confirm referral requirements, okay? So with the EPO, you do not need a referral, okay? So let's go up to the plans here. So let's look at these two options we have right here. We have an Embedder right here, and we have an Embedder here as well. So what plan would you choose just looking at these two plans? Well, I would say it depends, okay? So the first plan, $0 a month, zero deductible. Your max out of pocket is $1,700. Your doctor visits is no charge. Specialist is $10. Your generic drugs is no charge. Let's look at this next plan right here. Also $0 per month. There is a deductible of $550. Our max out of pocket is also $550. Okay, so this deductible means the plan will not kick in until you first meet your deductible, but you also have a max out of pocket of $550. So the most you would pay for that plan is $550. Okay, it does not count your monthly premiums. But the most you would come out of pocket is $550, not including your monthly premium. So this plan may actually be a better plan than this plan, even though it has a zero deductible. Why? Okay, so let's say this particular person have a very expensive medication that they have to take. Say they're on a medication and the medication is $600, right? So it's best for him to take this plan. Go ahead and pay for the $600 medication for that first month. And after that, there is no charge after he met that max out of pocket of $550. Everything else will be completely free. Let's look at the plan details. It says monthly premium of $0, deductible $550. Like we said, max out of pocket is also $550. And our primary care is full price, right? Specialist full price until you meet that deductible. This is before the deductible is met. But once that deductible is met, everything else is no charge. Look at this, guys. No charge for everything else. Generic drugs, brand name drugs, preferred brand, specialty drugs, all of that is no charge. This is an amazing plan. X-rays, MRI, blood work, everything is no charge. What he needs is max out of pocket. Even emergency room care, urgent care, hospital stays, everything is $0. I like it, okay? Even for baby care, labor, delivery, all of that is no charge. So let's look at the other plan that is pretty good as well. So this other plan is $0 per month, zero deductible. Let's look at the plan details. Okay, monthly premium is also $0. Deductible is $0, not $550. The deductible is $0, but we have a max out of pocket of $1,700. Pretty good max out of pocket. What does this mean? God forbid, say something happens, end up in the hospital. Hospital bill is $20,000. You pay your $1,700, and after that, the bill is paid for. So this is still a great plan. So 25% for emergency room, ambulance, hospital stay. Rehab services is no charge, so that's good. So overall, this is also a great plan as well. So if it was you, what would you choose? Would you choose the zero deductible or the 550 deductible? What are some other options just in case her doctor or his doctor did not take this plan? But we have a Aetna plan here for $13.44 per month. Still great plan, max out of pocket $1,700. Doctor visits is no charge, okay? So yeah, here are some other plans for about $30 to $25 per month. Let's look at the gold really quick before we end the video. So here's a gold plan right here. $0 per month. Deductible is $750, $7,500 for the max out of pocket. Doctor visits is $35, specialist is $55, generic drugs is $13. Let's click on the plan details here. And we're looking at about 35% after the deductible is met. And I would definitely have to say the silver plan definitely beat the gold by a long shot. So let's click back on this silver plan because I like it. Okay, so that is pretty much the end of this video. I hope you guys like this video. And like I said, if you need help, give me a call. All right, thank you so much for watching this video. Okay, so that is the end of this video. If you like this video, please subscribe to the channel. Give the video a like so other individuals can see this that need to see this. And if you need help with shopping your healthcare plans, give me a call. I'll be more than happy to help. My services are 100% free, and I will talk to you soon. Bye.